New York City Mayor Eric Adams announced a new policy this week of treating the city's mentally ill homeless residents, even if they refuse. The plan is aimed at the intersection of three of New York's most intractable problems: homelessness, mental illness, and crime. Outreach workers, city hospitals, and first responders will be empowered to involuntarily hospitalize anyone deemed a danger to themselves or unable to care for themselves. That includes people who pose no danger to others. Mayor Adams said New York City has a moral obligation to help.
If severe mental illness is causing someone to be unsheltered and a danger to themselves, we have a moral obligation to help them get the treatment and care they need.
Philip Yanos joins me now. He's a professor of psychology at John Jay College of Criminal Justice. So let's just start with the mayor's policy here. Philip, what did you make of it when you heard it?
I was very disappointed to hear about this initiative, as I don't think it's going to address the problems that the mayor is bringing up, and I think that it can cause harm. It can lead to situations which people are, harmed in their interaction with police. And I also want to point out that police officers do not have the authority to involuntarily hospitalize somebody. That can only be made by the hospitals themselves.
So let me take that apart. In terms of the harm, do you think there will be harm because the police? Well, first of all, are the police trained in the skills that would be required to interact in this kind of a forceful way with somebody who is experiencing mental illness?
Some police are. We had a crisis intervention team training in New York City over the last several years, but it's not all officers who are trained in that, and that includes training in de-escalation strategies that would, lead to a less harmful interaction. But I want to point out that Rochester, New York had this type of training, and it didn't stop the Daniel Prude situation from occurring. So that's not a cure-all. Right now we're moving toward not including police, if possible, in interactions with people with mental illness. And we have the pilot Be Heard program in New York City, which is very promising. So this is kind of going in a different direction. Explain
that pilot program and why that approach is promising versus what the mayor has just suggested.
Well, a lot of times when there's somebody who might be causing concern to others, and it's not actually an emergency situation. It's something that can be rectified through a conversation with a trained person, and that's what the Be Heard program involves. And a hospital might be called for, but what they found is that hospitals are actually, usually not brought in, and usually it's some kind of service, and there are locations where a person can be brought in where they can get services that are not hospitals. Hospitals are meant for people who are in an active crisis, and that's usually not the case in these situations.
You mentioned that police officers don't have the authority. The Brooklyn Center for Independence of the Disabled said that involuntary hospitalization constituted discrimination under the Americans with Disabilities Act. Does that seem right to you?
I mean, involuntary hospitalization is allowed under very specific circumstances. If a person's a danger to themselves, others, or there's this gross neglect category where you could think of it as somebody being so out of it that they might walk into the street and get hit by a car. These are the circumstances under which the law allows someone to be involuntarily hospitalized. Having mental illness is not a crime. Experiencing hallucinations is not a crime. And detaining people on the basis of, an assessment that they're going through something without knowing more about them, it's not going to work. So this might lead to removing people, taking them to an ER. The person's going to be discharged from there shortly if they don't meet the admission criteria. So it's going to tie up police resources as well from things that might be calling for more urgent need as well. So it might not be a good use of police.
Right.
In addition.
And finally, what's the process like of being involuntarily admitted in terms of checks and balances? You just touched on it a little bit there, but for someone to whom this might happen.
Well, there has to be, a psychiatrist involved in the decision, and there can be another mental health professional involved. Sorry, I don't have all those things memorized right now, but there is a process, and a person can dispute it, and there can be a legal review, after they've been admitted. So there are ways that can be contested after a person's been admitted. But it's not something that a non-professional can just do.
Right. Okay. Philip Yanos, thank you so much for being with us.
Thanks for having me.